A new law has been passed requiring licensure for genetic counselors across the state. Here to discuss what this means for patients, families, and the future of healthcare in South Carolina are two of the advocates who made this happen. Let's welcome Kim Foyle, Director of MUSC's Master of Science in Genetic Counseling Program, and Meg Keating, Genetic Counselor at Greenwood Genetics Center, Charleston. Ladies, it's great to have you both with us this morning. And before we get into this new license law, I think it's important that we highlight what genetic counseling is and what a genetic counselor does. Meg, if you could help explain that to us.
Absolutely. Yes, genetic counselors are very uniquely trained healthcare professionals. So it's our job to help patients and families understand if they might be at an increased chance of having a particular genetic condition based on their personal or family medical histories. So it's our jobs to walk through that history with patients and families, ultimately determine if there's genetic testing that's recommended, and then help families through that process of navigating genetic testing and any results that those tests might bring.
Mm-hmm. And this sounds like it kind of goes on both sides of the coin of preventative but also diagnostic as well, right?
Absolutely. Genetic counselors, upon receiving their Master of Science in Genetic Counseling, can go into a diverse number of specialties. Mm-hmm. So they practice in general medical genetics and see patients that might have developmental concerns, intellectual disability, or major medical issues, but they might also go into other niche specialties like cardiology and neurology. Mm-hmm. So genetic counselors practice in a wide variety of different specialties across the healthcare system.
Yeah, and I feel like the importance for genetic counselors is becoming more and more prevalent to all of us. And Kim, what motivated the push for this licensing law here in South Carolina?
Yeah, absolutely. So genetic counseling is needed by more and more in the population and as part of more medical teams as genomics becomes so integral to providing personalized health care. And South Carolina is actually the 36th state to pass a licensure law for genetic counselors. In the healthcare setting, most professionals are required to carry a license to practice, including doctors and nurses and mental health counselors, for example. And it's really a protection to the public, to our patients and consumers, to let people know that we are properly trained, credentialed, and vetted to provide competent and accurate care for their genomic needs.
Does this also impact accessibility of care? Like regarding insurance and things of that nature, Meg?
Absolutely, yes. So recognition of genetic counselors as these qualified, certified, and licensed healthcare professionals will better enable us to receive reimbursement for genetic counseling services, thus propelling genetic counselors and enabling us to hire and retain genetic counselors across the state of South Carolina.
Mm-hmm. And we mentioned that there's a growing need in South Carolina and around the nation for genetic counselors. Why is that? Are we seeing an uptick in illnesses, genetic, chronic illnesses? Is that why?
Sure. So there are many rare genetic conditions that are collectively common, but we are also gaining a better understanding of genetic contributions to common diseases as a whole, including cancers and cardiovascular disease. And more people are opting to have genetic testing even before receiving a medical diagnosis in the hopes that they may be able to prevent a condition from occurring for themselves or for their children or family members. Mm-hmm. So many people have access to genetic testing like there's never been before, and medical centers are beginning to offer, say, pharmacogenomic services that help predict medication response among individuals receiving treatment. And accurate diagnosis also leads to precision health initiatives that can really give the right treatment to the right person at the right time. So as these developments come about, there are more niche needs for genetic counselors as parts of specialized care teams.
Mm-hmm. And now MUSC has a genetic counseling program, correct?
Correct.
And now Meg, can you briefly tell us a little bit about Greenwood Genetics Center?
Yes, so the Greenwood Genetics Center is a nonprofit organization. We're actually in our 50th year of operation, so it's a big anniversary for us this year. And we have our main campus set in Greenwood, South Carolina, in the upstate. However, we have satellite clinics here in Charleston as well as in Columbia and Greenville. We primarily see pediatric patients. However, we see patients across the lifespan for a variety of different medical genetics types issues. And so at the Greenwood Genetics Center, we actually have interdivisional collaboration between our clinical division, which consists of physicians and advanced practice providers and of course genetic counselors, but then also we have a research division as well as a laboratory diagnostic division. So we all work together with the ultimate goal of increasing access to genetic services across the state.
Absolutely. Well, thank you both so much for being here and sharing about this wonderful new law. And I feel like genetic counseling, the accessibility is changing, and it's exciting to see where this will be in a few years. Thank you both so much again for sharing.
Thank you.
Thank you.
We're back after this.